past 3 decades, HIV and AIDS has plagued the people of Uganda, destroying families and taking years off of life from the average citizen. Uganda is a landlocked country in eastern sub-Saharan Africa and is home to approximately 38 million people.
According to 2013 estimates, Uganda ranks 10th in the world with 7.44% of its population infected with the HIV/AIDS virus, and 7th in the world with 63,000 AIDS/HIV related deaths. This represents a negative trend in the number of infections, as the prevalency rate was as low as 6.0% in 2005.
In 2013, 1 million children were orphaned due to HIV/AIDS mortality. 190,000 Ugandan children are currently living with HIV/AIDS. Further complications which have compounded the effect of HIV/AIDS in Uganda is the country's poor medical infrastructure, where there are only 12 physicians and 50 hospital beds per 100,000 people. Also, only 1/3 of the total population currently has access to improved sanitation facilities.
Our mission is to provide the Ugandan people with the right tools and education to develop a healthcare system that reduces disease-related deaths and the transmission of HIV/AIDS by providing professional medical care. Our first step is to provide mobile clinics that will operate around Uganda to provide free testing to people, especially in rural areas. We will attempt to model a token organization, turning used cars into mobile clinics with a midwife, counselor, nurse assistant, and driver to reach all 80 districts focused on rural population. Each mobile clinic will be equipped with a primary healthcare service package and CD4 testing for HIV. It will also have family planning, clinical, and preventative services for women, men, and children. Each clinic will be able to serve up to 1,000 people daily, provide baby formula with mothers with AIDS, and educate Ugandans on contraception. Nurse assistants will ensure monthly checkups with those infected with HIV and AIDS. This will provide and support those who are unable and unwilling to travel to an established health facility, reach males, females, mothers, and children, and give the best hope to stop the spread of AIDS. Due to its importance, we will give 50% of our budget to this effort.
It is estimated that by providing counseling and testing to 100% of never tested adults in Uganda by 2020, we prevent over 113,000 HIV infections and save approximately $734 million in treatment therapies. One of the ways to speed up this process is to promote education and careers in healthcare and medicine. While training doctors should be a part of the long-term solution in Uganda, this process takes several years. In order to improve healthcare in the short term to provide immediate results, careers as midwives and nurses should be promoted heavily, as their training is shorter and less rigorous, allowing them to enter the workforce faster. Ugandan universities promoting careers in nursing and midwifery will receive 25% of our total donations.
Limited male circumcision has also contributed to high HIV/AIDS transmission rates in Uganda. Only 26% of adult males in Uganda have been circumcised, yet it is estimated that circumcision reduces the risk of HIV infection in sexually active males by approximately 60%.
It is also estimated that by improving male circumcision rates to 66% by 2020, over 121,000 adult HIV infections would be prevented, and $790 million in treatment therapies would be saved.
Uganda is primarily a Christian and Muslim practicing country, and both religions practice circumcision, so religious barriers should not be an issue in promoting male circumcision. In the past 10 years, HIV/AIDS prevalence rate has increased 1.4% since 2005. In 2011, the contraceptive prevalence rate in Uganda was at a high of 30%. We intend to use billboards, public service announcements in order to change the public perception of contraception to make it favorable. We will also equip our mobile clinics with contraception to provide to local patients. Due to the availability of antiretroviral medication, Ugandans are complacent with stopping AIDS. Our billboard, public service announcement campaign will remind Ugandans about the horrors of this virus. That's why 25% of our budget is set to creating awareness in order to get Uganda back on track.
Our budget, consisting of $1 billion in total, will commit $500 million to mobile clinics, $250 million to universities in order to promote careers in nursing and midwifery, promote male circumcision, and improve sex education and the use of contraception, and finally $250 million to billboards and public service announcements, creating awareness.
With your help, we at the Uganda Relief Initiative can eradicate HIV/AIDS in Uganda by 2045.